Well, hi, everybody in the Devex community. I'm Raj Kumar, the president and editor-in-chief of Devex, back again with another of the series of videos we've been doing from my kitchen here in Washington, D.C. And this time, kind of a different conversation. I wanted to gather a group of leaders in global health technology, social entrepreneurs, people who are running relatively smaller organizations out there, changing things on the ground around the world. And I was really impressed to get this group of 5 people. I'll tell you about who they are in a second. Many of you may know for the work they do or their organizations do. But really the idea was to just hear what they're thinking and what's going on in the space of global health tech during this crisis moment. Meant to be totally informal. In fact, I asked everybody to bring along a beverage of their choice. And we can kind of keep it like a coffeehouse vibe conversation. Just I want to hear everybody's personal opinion, not your organizational view. In this incredible moment. So let me just say a word or two about who all is here, and then we can just jump into a casual conversation. So we've got Ernest Darko, who is the founding partner at Broadreach. Ernest, you're based in Cape Town right now, is that right?
Yes, I am.
And I think you might have, we were talking about this before, you might have the toughest of all the social distancing measures of anybody here, because in Cape Town, you can't leave your house. You haven't left in 3 or 4 weeks.
Yes.
Yeah. So I wish this were a real coffee house, Ernest, but you're
Exactly.
you're the closest thing you're going to get right now. Let's see. I'm just going down my Zoom gallery here. I see Josh Nesbitt, who is the co-founder and CEO of Medic Mobile. Josh, you're out in Seattle right now, and we'll hear more about Medic Mobile in a second. Not surprisingly, we have a few people from the West Coast of the U.S. So next to you on my screen is Nithya Ramanathan, who's the CEO and co-founder of NextLeaf Analytics. Somebody who may be known to you who follow Devex. We've quoted you a lot, and Nithya has spoken at our events. Nithya, you're in the Los Angeles area right now, I think.
Yeah, that's right.
And then next to you is Brittany Hume-Charm, who's the head of global health at Zipline in the Bay Area. Brittany, looks like you're hiding out in your bedroom, just like I'm in my kitchen.
Guest bedroom. Yeah, I'm trying to hide from the toddler upstairs. So
good. Yeah, good luck. One of the videos I did recently, the person, and it was live, the person I was talking to had to say, "Excuse me, let me pause," and had to yell at his son who was playing Legos right next to him way too loud. And next to you is Toby Norman, who's the CEO and co-founder of Simprints, an organization you founded in Cambridge, and that's where you are right now, right, Toby?
That's right, Cambridge in the UK.
Yeah, and so this is a techie group. You can tell from Toby's gamer headset. And so we might get a little bit into the tech. In fact, I would say for those who want to get into the details, feel free. And we'll pick this conversation up. This is going to be recorded, but folks who are watching this and see it online, if you have questions, throw them in the chat. We'll try to get them answered for you. And the reason really I think this is such an important theme, and it's not getting a lot of attention, is right now, so much of the focus is on the global pandemic and how it's hitting places like New York and Milan and London. But of course, it's coming in a big way in the global South. And that's been a lot of the result of the coverage we're doing at Devex. You can see that as we interview epidemiologists and global health leaders. They're telling us, be prepared, it's coming. But one of the key themes I think is underreported, it's under-talked about, is what does it mean for global health technology when we have so many new innovations that have been out there for a decade or more, and people advancing those, and now we're at this moment of crisis. And what can we do with that tech? What's possible today that wouldn't have been possible? Are we using it? Are we finding a way to actually get together? Are funders paying attention? Are governments paying attention? So this group, I just told you a very little bit about their titles, but it's a really impressive group, and we'll post their bios in the link. These are folks who are not new to the global health tech scene. They're real innovators and pioneers who've been doing this for a long time and have been pushing the envelope on it. And so now we're at this incredible moment. I wonder just how you see it, and maybe I can start with you, Ernest, because you're in South Africa, you're a medical doctor. I think you're the only medical doctor here in the bunch, but you co-founded an enterprising global health tech firm called Broadreach, and you're working with governments to help. It's kind of like the enterprise software in a way of the global health space, where you're trying to help make sure people are tracking the data and the metrics about what's going on in health, and then making good decisions based on those. How do you see that now that there's a pandemic hitting your country, South Africa? How do you see this playing out from your standpoint?
Well, what's been, I think, the most interesting to me is that we've actually been busier than ever. Like in our entire 17-year history, this is the busiest we've actually been. And what I find really interesting is we actually launched our platform in 2014. And I'll be honest, I mean, we've struggled to sort of, get adoption, from the marketplace. And I think we were, as you said, our platform aggregates data from across many different data sets and delivers proactive insights to decision makers so that they can optimally allocate their scarce resources for maximum impact. And it also then supports good implementation by using workflow toolkits to actually follow what individual staff members are doing on the ground and to support them to implement best practice with fidelity. So we've been trying to get traction in the marketplace since 2014, and like I said, it's been slow. And in the last few weeks since COVID came along, all of a sudden, it's sort of served as this incredible focusing mechanism where people finally appreciate what we've been trying to offer to the market all along. In essence, a system where you can respond in minutes and hours as opposed to respond in days, weeks, or quarters. And so being able to tackle a disease that's this aggressive and ferocious and moving so fast, means that you have to have the ability to know what's going on, in a very, very short time frames and make, very quick decisions and collaborate almost in real time as you're tackling it. And so luckily our platform was able to offer that. And we're seeing people finally say, aha, now I get what you guys are trying to do all along. And then the second thing I've noticed is I'm also finally seeing people willing to look outside of the strict boundaries of the Ministry of Health. So for example, in South Africa, where we have, I think, some of the largest inequities in the world, every year, usually we compete with Brazil for which is the most unequal country in the world in terms of Gini coefficient. And what we're seeing is, for example, we say you must wash your hands, but there's lots of huge parts of the population have no running water. You're saying you must isolate, but you can't isolate when you don't have electricity because you can't keep a fridge and you can't keep food that lasts long. So you have to go outside by definition very frequently to get food. So all of a sudden now we're getting requests for saying, can you monitor whether areas where there's no water so we can get in there and bring them tanks of water? Can you monitor where there's no electricity so we can bring these solutions to people in these populations to enable them to actually be able to adhere to these criteria? So although—
So it's broader than just health in the data now. It's like just really understanding what resources people have access to and knowing that in a real-time way.
And which actually goes to the proper definition of health, right? Health is physical, social, mental well-being, not just an absence of infirmity or disease, right? So if you don't have food, you're not well. If you don't have running water, you're probably not well. If you don't have proper housing, you're not well. So finally, you're seeing it all come together where people are realizing it's all linked together. And we have to tackle these things a little bit more holistically, which goes to the tenets of universal health coverage, et cetera, that we have to— I think it's a watershed moment for us to really re-examine the overall healthcare delivery model. And I think we were not doing it correctly. This is a chance for us to do it better once we get this behind us and hopefully can move forward in a model that is improved because of the lessons we've learned.
Yeah, I mean, we're going to need it. We're going to need this global health technology, this infrastructure right now, right? Not even just after the pandemic. Obviously, there's an opportunity to reframe how we think about the use of tech, but my guess is it's going to all be used right now in the response. In fact, I'm just curious, looking at people's nodding heads here, how many of your organizations are actually involved right now in the COVID response, or yeah, a couple of you are, and you, all of you are maybe, and you feel like you're gonna start to get more inbound phone calls of people saying, we really need to help you, for your help with contact tracing or understanding the data that's out there today, or in the case of Simprints, Toby, like being able to track the individuals who have cases, because what is it, 1 billion people in the world are not identified, and you're working to identify them with fingerprint and similar technologies. Maybe Toby, you can jump in and just say a word about that, because I'm curious where you see the opportunity right now to take something you've been working on, just like Ernest, for years, and see this launch at a moment when the world needs it.
Sure. I think one of the huge challenges that COVID is really driving home for us and a lot of our partners is how important it is to be able to link people consistently to a digital healthcare record. So if you look in the countries that have responded really well to COVID, so take, for example, Taiwan, something they've been able to do an incredibly strong job at is through contact tracing and testing, being able to actually track who has potentially the disease, who are they following up with, who's received what test, who's actually getting treated. And we take this, I think, for granted in a number of our contexts in the West, but actually, like you said, about 1 billion people globally, that's nearly 1 in 7 people on the planet, don't have any formal ID. So as we're trying to roll out these critical measures, both short-term, so for example, testing or contact tracing, but also as we think about the long-term response to COVID, the fundamental investments we need to make in health system strengthening, getting ready for a COVID vaccine when it's available, and making sure that actually gets through the supply chain to where it needs to go. We still have that same fundamental challenge that I need to be able to accurately and consistently link people to those health records. And it's a huge challenge. I think the sector's
probably less accuracy out there than we think right now, right? In other words, we of course, there's vaccination programs, all kinds of things like this that happen in the world of global health, but we're still reliant on a lot of, paper-based or very basic tracking of information. And we can't really know is there data fidelity here? And with something like a pandemic, you need to make sure you found every single case and that everybody got the vaccine who should get the vaccine, right? Maybe I can turn to Nithya quickly, because you're also, you got a computer science background, and you've been doing this for a long time. You think about how to use data, how to use sensor technologies, how to bring some of the tech that's totally common in the industrial and commercial spaces into areas like global health. So I don't know, what's your take as you look at this expanding landscape with this pandemic and the opportunity here? How do you see it?
We've been seeing, kind of similar to Ernest, that there's been a lot of people, ministries of health especially, leaning in. One of the things, our approach, I think, can be a little different, where we, than kind of the traditional Silicon Valley approach, where we don't talk about moving fast and breaking stuff, but instead talk about moving efficiently and fixing stuff. And I think that's been a big part of our approach and how we've been able to help ministries of health build resilience and countries build resilience. And so one of the things and the trends that we're seeing is that as ministries approach us, both in preparation for a COVID vaccine, but actually even just now today, because lab samples for COVID testing are temperature sensitive. So they have to be kept cold. And so there's a lot of interest in monitoring the cold chain, the temperature. And so because our solution is continuous temperature monitoring built in to strengthen the cold chain, that's kind of been part of the immediate response. But actually, when we take a step back, what hasn't gotten as much attention, and Josh and others can speak to this as well, is actually that a lot of ministries of health have had to pause their immunization programs because, of course, healthcare workers are staying home. And that's had really disastrous results, actually far more than COVID itself, and even possibly the potential of COVID. And so as you look at, I think now 23 countries have paused immunization, millions of people have missed out on vaccine doses. And in the DRC, for example, there's been an outbreak of measles, which is something like 5 times more infectious than COVID. And so just in the DRC alone, we've had thousands of children already died because of measles, because we've paused these immunization campaigns. So we've been focusing a lot with ministries, kind of going back to basics and just talking about the importance of health system strengthening. And ministries are coming to us and just really reiterating the importance of health system strengthening. So, separate from data, separate from technology, separate from sensors, it's kind of like we need strong health systems for COVID, but also for all of these other diseases, because resilience is so important right now. And so our approach has been looking at how do you build more integrated systems? How do you look across not only one vaccine or one commodity? How do you look across lab samples, vaccines, all these different kind of temperature sensitive commodities? And, as I think you're starting to hear on the call, a time of disaster, a time of, shock is often a time when people are thinking differently, thinking bigger. And so I think there's this real opportunity to, for all of us as a sector, to really come together and really listen to what ministries of health are saying they need, and really kind of helping to respond to that. So I'm sure on this call we'll get to kind of the approach to designing technology and what we can all be doing. But I'll kind of just really quick anecdote. California, we got some hundreds of broken ventilators, right? And so there was this, big kind of hue and cry, how could this happen? But of course, we've been doing this to countries for a really long time, sending, equipment that is broken, old, badly designed, all of that. And so I think my kind of the thing that I'm leaning into when I talk with other enterprises is this is our moment to really step back and think about, what do countries need? Do they have the resources and infrastructure to take in that solution? And are we going to have the supply chains and financing mechanisms in place to ensure that that solution, whether it's a ventilator, whether it's oxygen therapy, that solution can be used and successful?
You know, you're making me think of like kind of two threads that I hear a lot about, and this is my take on it. I'm curious to think well, hear what others think. But you know, one thread is kind of the partners in health worldview, which is, hey, every human life is equal, and we ought to be bringing the very best of our, you know, medicine and health technology to every person on earth. That should be our mindset, and I totally agree with that. And on the other hand, you have this reality of this tremendous disparity. So when you talk about health systems, right, a lot of the mainstream journalism that you read about, it says, look, the number of ICU beds in New York is X, and in a place like Malawi, Josh, where you started out your work, you know, it's a dozen or something in the whole country, right? And it's, so you're looking at those huge disparities. The health worker gap, it's 38 million gap by the end of the decade. So the truth is, like, are we really going to close those gaps? Are we going to have a health system in the low and middle income countries that looks like that? In advanced economies, probably not. But there is an opportunity, right, to do it in a totally different way, to use community health workers and mobile phones, to use data systems, to use sensors, to reimagine, like, what does that strong health system look like, while still, you know, caring about the equity issue, you know, still with that mission behind it. And I guess, Josh, I'm curious your take. You've been also doing this for a long time at Medic Mobile, and really trying to, you know, tap the important value of the cell phone and connectivity as an incredible tool for these systems. What's your take on kind of where we are today? What does it mean to strengthen these health systems? How do we address this moment that we're in?
Well, thanks, Roger. The first thing I would say is those two threads you laid out feel very related. That the current disparities we see are related to gaps in our moral imagination, right? So they feel like an interrelated project, is what I would say. And this certainly feels like a moment where we're called to bring as much imagination as we can. And I'll be honest, I do not view it as an opportunity in so much as a crisis. We have to land a plane right now, and then we're probably gonna have to take off again and land again, and over and over and over in lots of countries and lots of counties and contexts. And I guess just to take the metaphor one more step, you know, you might ask, who's flying the plane? Who are we asking to fly that plane? And, you know, Medic has been standing alongside community health workers for the past decade. And we do so now, just in a very different way, as we're not traveling. You know, community health workers are on the front lines everywhere. And I think one potentially helpful frame is just to think about the people and what we're asking them to do right now, and whether or not our whole community, including technologists, are stepping up to support them. So the list, I keep every day, I add to this list. What are we asking community health workers to do in the direct response to COVID and in maintaining primary health care? And the list just keeps getting longer, but I don't see the list of resources getting longer necessarily. So that, I think that's a call.
In many cases, as we report on Devex, you've got a lot of these community health workers who are being sent out with no personal protective equipment at all.
Exactly.
And even in the WHO estimate, they weren't even included in the original estimate. I don't know if they've updated it yet, but that was something else that we were reporting on. So it just shows you how we think about those CHWs.
Exactly. Yeah. And then, you know, very, very practically, I think we have to be deploying national systems remotely right now for every community health worker in every community. That's a challenge that us and others are solving for this week. You know, so I think, and those protocols change every other day. You know, we were focused 2 weeks ago on event-based surveillance for all of the COVID signals. And to Nithya's point, as soon as we had to halt vaccination campaigns, 3 more vaccine preventable diseases were added to the critical list of signals to monitor. So that's just one example, but every other day, national protocols are changing because these systems are evolving.
And so just so I can underline what you're saying for people who are watching this, what you mean, as my understanding, tell me if I'm wrong, is that you're talking about CHWs who are out in the field, they've got a cell phone, and that cell phone is giving them some kind of a software tool that they can use when they go house to house. They can record what they're learning, if people are ill, et cetera. And that there's got to be some national level plan about what kind of data they're recording, especially with COVID-19. And that might mean updating those tools they're using. My understanding is in a lot of countries, there are multiple tools, right? Because they might have one tool for HIV and one tool for malaria given by a different program funded by a different organization. I see you nodding, but explain this a little further. What's it like? And do you see an opportunity right now to do something about that, to actually unite those tools and make this work?
Yeah, these things are all connected. So most community health workers on the planet right now do not have any meaningful support in terms of a digital tool. We're attempting to correct right now. So every community health worker that is not supported today has to be equipped as fast as possible as part of this COVID response. That's an example where we need to change the status quo. Then there are a bunch of disparate systems. I'm looking over at Ernest. We have to make sense of those data streams altogether. That's a problem that has to get solved. And I'm excited for our first deployment together. We have to figure that out. Yeah. I think there's just so many examples of things that these long-term crises like HIV, AIDS, and maternal health, we just, for whatever reasons we did not solve for, we've got to solve for all at once right now. And that's the feeling that I have.
Yeah, and if we don't, to Nithya's earlier point, remember the Ebola crisis in West Africa 6-7 years ago now, we had, I think, 11,000 people ultimately lost their lives, which is a huge tragedy, but many multiples of that died from other things because malaria patients, couldn't get seen at the clinic, and a lot of very easily preventable things. And so in the context we're talking about in the global South and the lowest income countries, that's going to get a lot worse than it is, for example, in places like where I'm sitting in Washington, D.C., where the health system is strong enough, there's enough money spent that they can build a tent next to the hospital, or take the convention center, and they can expand the opportunity to treat the heart attack as well as the COVID-19 patient. That's not necessarily going to be the case in a lot of these contexts. And we do have to think about the system. And Brittany, bringing you into the discussion, that's something I know Zipline has thought a lot about. In fact, I don't know about for you, all of you, but for me, every day during this crisis or every week feels like a year. So it's hard to believe, but it was 1 year ago that I actually visited Zipline in Rwanda and got to see up close and personal how the system works, which is pretty impressive. You've got these drones, these UAVs that are delivering blood supplies all over a very hilly country that takes a long time to traverse by motorcycle or truck. You bring it with a drone in like 45 minutes. And that vision you're taking to other countries, other locations. But I wonder how you see this fitting in. Is Zipline getting engaged in COVID-19 response in some way? And have you been thinking about the tech infrastructure as a system, not as a individual disease approach for a long time, but how do you see that now in this crisis?
Absolutely. I mean, so we are actively involved in the COVID response of the governments of Rwanda and Ghana, where we're operating now at national scale. And it's been, I think many of the points that have come up on this call already, I've been kind of jotting down all of these notes that just resonate with me so much. I think, what we're seeing here, I agree with Josh, this is really a crisis. We are seeing creativity within that crisis to, see how do you actually take, things that have been true for a long time that are now exacerbated even more, like, scarcity of resources and asking, too much of health workers. How do you take that? And, when you recognize that it is, at a breaking point, be able to actually adjust the system to be able to have it serve the most important and essential services. So, what Zipline can do by being able to deliver, blood and emergency and essential vaccines and emergency and essential medicines, or PPE, what we can do is actually be able to match supply and demand in real time through on-demand delivery. And so when you have, a scarcity of PPE or test kits or medicines that are needed across the country, you can centralize them and be able to make them available everywhere in the most efficient way possible, without actually having to have, as many as you would need if you were to be, pushing them out across the system. What we're seeing is that this is critical not only for, of course, COVID response, and preparedness through, delivering, as I said, PPE in Ghana, as well as things like infrared thermometers and hand sanitizer. I mean, they need all of these things at the last mile in order to be ready for this. But also to serve the need, as many of you were talking about, and particularly just now, about continuing access to essential healthcare services and treatment, like immunization, like HIV, TB, and malaria treatment. How do you make sure that all of these services can be maintained during this time when actually everyone is supposed to be, staying where they are? And the theme that also comes to mind here is really about health equity, right? I mean, what we see is that the communities that are affected most by things like a shelter-in-place policy are those that don't have the resources there. And so for example, Northern Ghana, we see that about 2/3 of health facilities don't have cold storage on site. They actually have to go and go pick up the vaccines. That's, by the way, a responsibility of the health worker to go and do that traveling.
You can add that to your list, Josh. You probably already have it.
Exactly. And so how do you actually make it so that things like those vaccines or the HIV treatment or the cancer treatment of patients who really shouldn't be outside of their house because they're immunocompromised? How do you make it so that they can be served through telemedicine or through their community health worker and be able to actually deliver what they need to them so that you don't have this collateral damage that we have seen so many times before, including in the Ebola outbreak. So, those are a lot of the things that we're really working through. And, we see that this creativity from our partners, including the governments of Rwanda and Ghana, is extending to many other parts of the world and to, other agencies. And so I think, some of the ways that you can actually begin to think about what are the possibilities here. Some of those barriers are starting to be moved as there's just been this universal, literally global recognition that a lot of these concepts are important, whether you're talking about the global South or here in the U.S.
Can we just talk a little bit more about that, Brittany? Because before you came into this role, you were in the foundation world. You were at Skoll most recently, and you've a lot of the social entrepreneurs, including yourself, like you've known this group, and I've got the pleasure to meet, folks like you around the world. They're all, this incredible cadre, probably in the last decade or so, of social entrepreneurs, a lot in the global health tech space, who have kind of fought against the odds when there was very little funding, a really complex sector to break into, and they've done it. And now you've got all these platforms that are out there, all these tools and technologies. And here we are at this moment of crisis. Like, do you think it's going to be possible to knit this all together at once? Because presumably, like what Nithya is working on, cold chain sensors, that's got to connect with a delivery system like yours. It's got to connect with an enterprise software like Earnest, and an individual tracking and identification like Toby's and Josh and Medic. Thinking about the front line, getting the data and getting those resources to the person who needs it. Do we have a chance to stitch this together now? How do you see it, given that you've had that bird's eye view in your past role, at least?
I think what we see from history is that there are phases to this. And so the first phase is just this immediate crisis response. And that, I think, is the phase that we are in right now. In some places, it feels like we may be starting to move to the second phase, which is starting to kind of feel like, okay, we can start to have a conversation about something that is, aside from PPE. How do you start to feel like, okay, we're going to be in this for a while, right? How do we recognize what we need to have in place for that?
That is how everybody here feels, right? We are going to be in this for a while. I just want to get like a nod from people. Yeah, we are. Okay, sorry. Go ahead, Brittany. That's my feeling too.
Definitely, yes. And so I think there's then this kind of second stage, which is, that creative stage, right? If you have kind of your blinders on during the first stage and you're like, I can't talk to anyone unless this is about something that is, like you're actively fighting a fire, right? You're like running to the scene of the fire to fight it. I think this second stage is really about, recognition that you need creativity. I think that there's a moment here where we can begin to have those conversations. I think my hunch is that the funder community will be able to come to our aid in the third stage, which is starting to think about actually how do you become better prepared, how do you become more resilient, and actually make sure that there's kind of that never again moment. And that, I think with this outbreak, I'm not sure exactly how long that second stage is going to be, but I think it's a call to action for all of us to, I think, begin to have those conversations so that we can be ready to have an answer when suddenly the people who have those resources are able to turn their attention to say, okay, if we were to rebuild and start to think about how health systems can be better prepared and stronger moving forward, then what does that include?
Yeah, and I think the funders seem quite lost right now. I mean, I think they need that creativity and that vision from folks like yourselves, because mostly they're saying, all right, we can do debt relief because that's quick and we kind of get that frees up resources for governments. And then they're thinking very internally, like, all right, what's our mark we can make at our foundation, with the money that we're going to put out. But in reality, the amounts are pretty small. That you've heard announced at this point. I had Mark Dybel on a conversation like this last week or 2 weeks ago now, it's all blurring. And Mark, of course, was instrumental in creating PEPFAR, which I guess is the largest global health initiative in human history at this point, and ran the Global Fund. And I said, what should we be doing? And he was willing to go out on a limb and actually say, well, my back of the envelope is we need a $30 billion commitment right now to, global public health. We need to build health systems. And actually, that's very little money if you think about it. And we had a $2 trillion stimulus bill already come through here in the US. You had many similar massive stimulus in big advanced economies. 30 billion is something like a quarter increase, maybe a 25% increase in annual official development assistance. So in some ways it's not that much, but we're not really hearing big, bold, either numbers, costed plans, or visions about, all right, look, we don't have to do this the same way we do it in the West. We could do it in a very different way. Yeah. And so I see some nodding heads around that. I'm just curious how people think we ought to take that from here. I see Nithya, maybe you want to jump in.
Yeah, sure. I think I so strongly agree. We need a strong vision about how this is going to be different, and it does not have to look the same in every country. I think that is one of the really huge advantages of technology and data, is that we can start thinking about what are the localized, both existing resources as well as the resources that a country needs to build something really different. One of the changes and trends that I've been seeing, actually even pre-COVID, but that I see really accelerating, is country-led thinking, country-led design, country-led development. It's becoming much more than just kind of a talking point or just a frivolous sort of thing we say, but that I really see donors like Gavi leaning in and saying, okay, this is the time to really pause, actually, and really hear what countries are saying they need. I'm really excited about that. I'm seeing more.
And I think often what they're saying they need, and if you start to interrupt, is cash. Meaning, it's one thing. I was talking to a health minister, say, yeah, we get a certain amount of vaccine and that's great, but actually we can't deliver all of it. And if we could just get some more cash, we can strengthen our health system. But historically, anyway, donors have sort of been more willing to fund something like a vaccine itself rather than the underlying system.
Yeah, and to that point, I mean, I'm really happy that Gavi is actually leaning into that and saying you can spend your money more flexibly. They're really looking to increase the funding envelope for countries in terms of health system strengthening. So in terms of building resilience, ultimately, yes, it has to be more money, more flexibility for countries, and really listening to what countries say that they need to do something different.
Yeah, it makes sense. I see a few people nodding. Anybody want to jump in on this?
Yeah, for me, I think the single biggest mistake we could make right now is to let COVID become another vertical program, right? That drives this massive, vertical wedge with a lot of priority around it, another silo. And the last thing we need is this to become another silo. And I think, to be honest, I'm concerned that, because I'm not sure which way this is going to tip, right? And it could very easily, because of the intensity of the crisis, tip into just becoming a silo that then leaves us vulnerable to the next shock or the next epidemic. Or alternatively, there's that moment where if we get enough leadership putting their heads together and realizing this is our moment of opportunity, right? To change the way we're doing things to improve, then you get, for example, funders aligned with around concepts like it's actually sexy to fund primary care, right? Because that's what health system strengthening is about, right? And up until COVID, I'll be honest, I mean, this has been the issue, it's fragmentation. That's why you have so many different data systems and every little silo on its own base that doesn't communicate. And we've failed woefully at integrating, right? Because they were told, oh, we need to integrate these things. They never seem to integrate because they were not designed to be integrated. And I think this is a chance to really use this as an opportunity to coalesce around a model where we start to fund the things let me say, fund things in a better way. But, and I really do hope that that lesson is not lost. And I don't know who we speak to so that this conversation can occur at the right levels now before we miss this window of opportunity.
It is a window, right? I mean, it is a window. I agree with what Josh said earlier. It's more crisis than opportunity today. It feels like a real crisis. But in a sense, there is a window here, you know, to Mark Dybul's point. If we could just get the world to say, now you see what it means when you don't have strong health systems, and they don't have to look the same as they look in the rest of the world. They can look different. They can be based on real community need and resources, but this is the time to do something. Toby, did you want to jump in on this?
One of the big challenges, to Nithya's early point, is that there's a strong temptation. Everyone wants to move fast right now, and that completely understandable and it's important. But if we think about what is going to matter in the long term, because like you said, Raj, this isn't just a one-off. This is going to be affecting our lives for months and years. And so we need to move efficiently, and we also need to move smart. And I see some partners moving quickly. I think some of the work that Children's Investment Fund Foundation and Partner Foundation is doing is really exciting. But like you said, a lot of the funders are hesitating. They're not sure yet because they're not sure what's that smart move. And the smartest move we could make is investing in that health system strengthening, that long-term preparation to see out COVID and the response to COVID that we're going to need for the next year, but also to make sure it's underpinning all of the other stuff that we're risking forgetting about. You know, if you look at Ebola, more people died of measles than Ebola. It's these types of mistakes and these types of fears I think we're going to see on the front line.
I mean,
hey, Josh, go ahead, Brady.
I'm sorry. I was just going to say I couldn't agree more on this health system strengthening and resilience front. And it's almost like, you know, it's I think for many people in global health, it's like the worst kind of deja vu, right? Mm-hmm. When you see these sorts of crises happening, and you know that ultimately it all comes down to, you know, having the right parts of the foundation of a health system in place. And when you don't have a health system that has a lot of the tools, frankly, like that are represented here on this call, right? That has a strong network of health workers with ICT that's connecting them, a supply chain, electronic records, right? I mean, this is a national distributed way to be tracking the health of your cold storage, right? I mean, all of these things are so critical to be doing, to be providing health services on a day-to-day basis, but they're not sexy, right? I mean, to the point earlier, during normal times, which is why, sometimes, they are often underfunded. And now it's like, how do we bring it back to this? And we say, like, what this, some of the common points are here that, with other epidemics that we've seen in the past, or how do we keep coming back to some of the lessons that we have learned from Ebola and others, and point out that a lot of these things really are preventable. And I think what I think is most compelling is actually to be looking at the bright spots, right? So how do we take the countries and the systems that are going to be working really well through this, and actually begin to make sure that we're capturing those stories really well, and we can be using them as case studies in this next stage, when we can be, actually getting those funders who, are looking for the evidence as well. And if they're a little bit more risk averse, a lot of the funders are always asking for data and evidence. So how do we actually make sure that this isn't just anecdotal? And it's, whoever has the loudest mic, can suddenly get the resources. But I think there it's, incumbent upon all of us, as well as those health systems themselves, to say, actually we did invest in this when it wasn't sexy. And now look, we actually are able to respond in a better way. That's really what I'm hoping is going to happen coming out of this.
And the loudest mic is a challenge. The other challenge, I think, is scale. Like what I'm hearing from a lot of donors is when they need to push money out the door really quickly, and they think, well, who's got the scale to manage all of that? And in the process, they might miss a lot of the social enterprises that were set up in the health tech space over the last decade, like yours, that are getting to some scale. They're not as big as many of the big global corporates, but they have real solutions that can work, that are grounded, that have data and evidence behind them. But it will take a slightly different mindset to get funding to those kinds of solutions than maybe the way donors typically operate. I wonder what your take is on this, Josh, having worked in this field for quite a long time.
Yeah. I'm going to provide just maybe a complimentary, hopefully complimentary message to the funding question. I think for the basics, like PPE for community health workers, we have to take a no regrets approach to funding, and we need to move resources as fast as possible. And as new national programs or platforms are getting put in place, we can't have amnesia. We need to remember everything from the past, put all of that knowledge to work in the design of the system that's launching with the urgent funding, and set it up so that we can do analytics 3 years from now. We can deploy SIM-prints. We can get drones to everyone, and every device is monitored and every health worker is supported. Just remember design principles, but act with urgency. So something like that is what I'd probably hope for. And I love this call for a PEPFAR for COVID. That's 30 billion, maybe 300 billion. I'll just not bump it up.
It doesn't hurt to think big now, yeah.
Maybe 300 billion now instead of 30 trillion later.
Yes.
And that makes sense, but it can't be vertical, to your point, Ernest. So I think the details and design matters. I think is where I'd land there.
Well, let's talk about the tech a little bit if we can, because again, a lot of the organizations you all founded, they started a lot earlier, and the tech that's happening now, there's new opportunities. One of the basics, I think Brittany was getting at this, is connectivity. So I talked to some folks in Silicon Valley who say, look, the connectivity issues are getting solved. We have new technology around this. By 2025, high bandwidth, even in rural areas. Of course, we can't really wait for 2025 given the crisis right now. So I'd love to hear what your thoughts are on kind of the tech issues that we need to be thinking about and tackling. There's connectivity, obviously. There's maybe the use of AI or ML in the diagnostics and helping community health workers and others to diagnose. There's obviously drones and UAVs, and there are many applications. So I'd just love to hear any of your thoughts on kind of where the latest tech is and what we should be thinking about as a community.
So,
Toby, I'll let you go.
Sure, just a couple of thoughts. What I think we've seen over the past 10 years is a lot of the fundamental challenges preventing tech being used on the front lines have started to resolve. So bandwidth and connectivity has increased a huge amount. It is no longer a question, can we have frontline healthcare programs with community health workers, for example, to Josh's work, using smartphones to do not only data collection, but start to do basic diagnostic pathways, start to do far better quality data analytics. And that opens up, I think, a really exciting range of applications, from ML all the way to doing better sensing, to the work that Anthony and others doing. So there's a ton of that foundation is there. I would caution, I think, during a moment of crisis like this is not, the next 2 months is probably not the time to experiment with brand new and untested technology. There's lots of excitement. I can't tell you how many times 2-3 years ago we had partners asking us, hey, could you deploy this with blockchain and things like that? And there's that excitement around technology. That's part of, I think, what makes it a great field to work in. But I would say the next 2 to 3 months, this is not the time to experiment with that very untested cutting edge. We just need to focus on the fundamentals, focus on the basics. What I think there is an opportunity to do, and a lot of folks here have spoken to it, is if you invest in those fundamentals now, when we think, okay, 6 months, 12 months, 18 months, that fundamental health infrastructure is in place, then new technologies, the latest, can scale so much faster, so much cheaper, with so much more predictability and so much more transparency than we ever could have done 5 to 10 years ago in this space. And so I would say really focus on those fundamentals now, because that gives us the infrastructure, the platform, to be able to leverage the latest tech, which is coming in. There's a lot of really exciting stuff coming down the pipeline. And if we have the fundamentals there, we can make use of it.
Ernest, you want to jump in on this? Oh, go ahead.
Yeah, sorry, one quick thing just as an observation, and really agree, Toby, 1000% is what you said, is that in my humble experience, you know, the tech is the easy part actually at this particular point in terms of in and of itself, right? We spend, I say the 90% difficult part is figuring out the human side that interfaces with the tech and getting that to work well, right? There's a friend of mine and another sort of social entrepreneur from Nigeria, Dr. Ola Brown, who she kind of jokingly says, you can't app your way out of bad governance, for example, right? And at the end of the day, I think the technology can walk the horse to water, but it's not going to make that horse drink. And so if there's any, I always jokingly say when we talk to people, like, we've learned more about what doesn't work than what works. And what we have figured out about what works is you have to get the human side right? At the end of the day, there's somebody at the end of those analytics who still must act on them, right? A supply chain must be there that actually delivers the PPE when someone in the app has said, I don't have PPE, right? That supply chain must work to get it there, or the cold chain must work to get that vaccine there at a quality level where it can be used. So from my side, to Toby's point, you can experiment with stuff and write apps in literally hours, but what makes it work at the end of the day is that you've actually figured out the human side. I know Zipline, for example, you know, with the founder of Zipline, we've had so many conversations about the frustrations we've had dealing with just the people aspects of this, right, behind the scenes. And I think this is a time where those hard lessons then begin to actually can help you scale much quicker than simply a pure play, here's a technology that I dump on you and hope that by its very nature, it's a silver bullet. It just doesn't seem to work in my experience.
Nithya, I think you wanted to jump in too.
I was going to say exactly, but not as well, what Ernest said. So I'll add a different point which is kind of growing on Ernest's point, two things that we've seen. One, healthcare workers are being asked to do so much, as we've said, and especially when it comes to technology, that's now this new thing that's being added. But I do think that there's a real opportunity here. Healthcare workers are technology workers now. And as we think about integration, it's not just integration across data systems, it's not just integration across health systems, but really thinking about, you know, we need better universities and training for healthcare workers that is building in technology, that's building in data training. We're seeing inside the Ministry of Health, they don't want to import a Nextleaf or any other worker to sit inside the Ministry of Health. They want their people to have the training and statistics and data. They want their people to be building up that technology capacity. And that's exactly what we want as well. I don't think any of us got into this business saying we want to do everything. You know, we got into this business saying, hey, we can build technology. We think we can build it really well for what you need. And I think just by virtue of the situation, I think all of us have, really kind of expanded outside of that mandate, because exactly to Ernest's point, it's the people part of it. But imagine what we could do, as Toby was saying, imagine what we could do if there was integrated cloud infrastructure in country, so that the Tanzanian Ministry of Health didn't have to put a laptop, under somebody's desk to host data in order to meet the national regulation of local hosting, right? Imagine if there was integrated cloud infrastructure hosted in Tanzania or Kenya or South Africa that all the ministries of health trusted. Imagine if there was a university that was training healthcare workers, but also providing training on data, on statistics, on technology, so that healthcare workers had not only the voice and power, but had the experience and expertise to say, hey, no, I don't want that in my app. Let's do it this way. You know, they have the experience. You know, Josh has led the way in terms of user design. We know that they have the voice that needs to be listened to, but imagine if they also had the technology expertise and they could do some of that rewiring themselves. So we're really thinking a lot about not only technology and innovation, but how do you balance that innovation with responsiveness, and how do we build that integration across the people, across the solutions, so that we are all set up in 10 years to be working together and scaling faster.
It's such a great point at the end. It's a key element of sustainability too, right? You know, so many of the bad stories, the ones you hear that you just, oh my God, how could this be the case, is great apps, great, you know, software design that gets rolled out in a country under a project, and then the project ends and the funding ends and it goes away. And, you know, the needs haven't gone away, but the funding isn't there and it hasn't been integrated locally. It isn't owned locally. It can't be iterated on locally. So, you know, you're so right. It's both about making sure we have a different mindset around sustained system level funding, but then also that these things are owned at the local level, that communities own them, healthcare workers own them, ministries own them, and they can take it forward as they need to in their society. Josh, I saw you nodding a lot. What's your take?
Yeah, no, I could not agree more. And Nithya, just to build on that, I think that there have been concerns about technology and global health that I understand. And a concern I hear a lot is that we are introducing new dependencies into already constrained systems where there are certain power dynamics. And so that I think we need to address head on, basically. So as we think about what's deployed and how, we should directly address false choices. I'll give two examples of sort of false choices. One is a false choice between privacy or protection.
Yeah.
I'm seeing Toby nod. Another choice would be a choice between a good algorithm and an examinable algorithm.
Exactly.
These are false choices, and they're going to get pushed in certain ways, and we just have to push back.
Yeah.
Can we just dig into those two for a second? Because you know, the first one's really clear. That's like in your case at Simprints, Toby. You know, people will say, well, if you're going to ID somebody digitally, what if that gets stolen? What if it gets taken by the wrong groups? There could be human rights implications if you could be tracked. And of course, we're dealing with those privacy questions everywhere in advanced economies too.
Yeah.
I think that one's pretty clear, but maybe we can dig into the second one, which is about, I think, more about artificial intelligence algorithms, right? And like, you know, does every ministry need to be able to understand everything the algorithm is doing and look into it? You want to talk a bit more about that for a second, Josh, or anyone else?
Well, all I would say is that it may not be that you understand the Python code, right? But you should be able to understand the guiding principles of an algorithm and what it's achieving, and where risk thresholds are set. Just the basics. So I think there's certain AI functions as a black box on purpose, but we need to know what's going into and coming out of that box, right? And so it's sort of a call to maintain as much transparency as we can into whatever is being deployed, and just keep power and information dynamics and asymmetries in mind.
Ernest, you wanted to say something about it?
Yeah, I think for me, the one frustration I've had, you know, primarily having spent my time working in Africa on the ground, is that often there's a push for some reason in Africa for solutions that are not scalable, you know, or that do not have scale, and therefore by definition have a really high unit cost, right? And prior to this whole kind of fourth industrial revolution, you know, tidal wave that's come, was pharma and the issue of, you know, for example, local manufacturing of pharmaceuticals. And I remember there's quite a big push towards, yeah, you know, we need to manufacture locally, et cetera. But when you try and compare yourself then against the scale players like in India, right, and China, that local drug would end up costing, you know, like 500 times, you know, what you're going to get it for from, you know, one of the big generic companies. And so there's a balance, I believe, that we have to strike between, you know, finding the right thing that works well at an affordable price, right? And buying that, as I'm sure, I always say, like, if you go across Africa, everybody wants an iPhone. Everyone wants a Samsung phone. No one wants a locally built South African cell phone, right? So there's some things, and what are you benefiting from by, locking into those platforms like Microsoft or whatever? You get security. You don't have to try and build that all yourself from scratch in Africa. The place where you have the least, technological capability to build that level of advanced tech. So I think there's a fine line often between where I found the weakness is people don't know how to choose, right? And what I found is, for example, one time I was I won't mention the country, but I was close enough to a procurement that they were making for a health management information system for the country. And they sent a team of only doctors to evaluate a system to see it at work in Dubai, right? Only doctors were on the team, right? And they literally went saying, oh my God, I love after the sales pitch, we want every single module of this thing. Not understanding the technology implication, not understanding that when the red light starts blinking, a guy had to fly all the way from India to come in and figure out how you switch it off. And by the way, he's got 7 other countries before you, so he can only get to you in 8 months. So just being educated enough about how to select technology that will work for you, that has the right fundamentals underpinning it. I think, to me, that's an element here that is even more critical than the short term, here's an app that has some promise. Is that really understanding, therefore, I'm going to invest in this because for the long term, I can develop a long-term relationship. It will be supported. I'll get the benefit out of this that I need. And I don't get me wrong. I'm not saying we should never manufacture in Africa, but we need to figure out better strategies of approaching manufacturing than every one of the 53 African countries trying to manufacture for itself. We'll never get there. And I think often the conversation goes there, and that's another, to me, dead end sort of strategic approach that will not work for the continent either, given the vast variability in size of countries, et cetera. So
maybe we need something, Ernest, like a Gavi, some kind of international alliance that helps with the purchasing of these systems and software, that helps address some of the things Nithya mentioned in terms of, like, cloud computing and where you host this stuff, that can create some legal frameworks that governments can buy into.
Yeah, I mean, Botswana has like 2 million people, and then they're going to have their own cloud, and I mean, it's, when you start to, then there'll be so much time wasted in trying to procure that for one country instead of doing it on a regional basis or larger, right? So,
and it would certainly make it easier, right? And it would certainly make it a lot easier for organizations and companies like Zipline, let's say, to say, hey, we have a solution here, we offer it, and then you could be pitching it to this one international alliance, which can help countries decide where is it relevant for them, how should they configure it, not have to go country by country, and probably what's a pretty slow, painstaking process.
And in country, it's often province by province like us. So now you have to deal with 9 separate provinces in South Africa. So, it just is impossible.
Yeah, I totally agree. And, Raj, I think you saw the nerve and struck it in terms of, Zipline's growth. But, I think really where kind of maybe taking this conversation full circle, like where there, I think really is an opportunity for using this, moment of streamlining, and for funders to step up, and really, be able to use some of the things that, that they love to talk about so much, which is, what is working, right? I think we could, almost kind of get to this point of having, like, in some ways, like an improved vendor, set of options, right? And like how to help governments actually choose, what is appropriate for them. Going back to what Nithya said before, it's like, I think we need to recognize that the governments are the ones who are in the best, position to be deciding, but they oftentimes, don't know how to even begin. And how do they evaluate, one vendor versus another? That can be a very slow and painstaking process where, it may be even using, they may not, have offhand, like the knowledge of how to even evaluate those. And that's something that, we see a lot with, with governments where they're like, we don't know how to evaluate a drone vendor or think about how to procure you. And so, really having like a central facilitation of that in order to say, here are some of the things that you need to know if you're going to be evaluating, a mobile health solution for community health workers, or, or an electronic, information system for your country or for your province. And so how do you actually begin to identify these points of friction that may have slowed things down in the past? And I think everyone on this call can probably think of a few of those for what they do. How do you identify those points of friction that happen in almost every engagement that kind of slow growth? And if we want to be, using this moment to accelerate innovation and scale, then, help to work to kind of grease the skids around those. And I think that a central coordinating body or kind of set of best practices or a vendor list or whatever it is, I think could go a long way in saying we actually do know what does work. And you don't have to start from scratch if you want to imagine what a more resilient and stronger health system really could look like.
If I may add a quick anecdote to just tell you how bad it gets, that HMIS system I mentioned that country is trying to procure, when it went to tender, they got 2,000 responses to the tender, right?
Yeah.
And then the ministry created a 100-item checklist, evaluation checklist that you had to apply to each received tender document. And there was only 3 people in that ministry who were supposed to evaluate these 2,000 tenders, each with a 100-item checklist.
Mm-hmm.
It took 5 years to procure, and then the procurement was challenged, and they had to start from scratch again. Mm-hmm. I mean, this is a real example of doing it the right way, but it's quicksand. You can never get out of. So then this is an issue that really does need to be, say, procurement reform, or
Mm-hmm.
it really does need to be looked at, because, and these are governments trying to do it the right way, right? And this is why it cannot respond in a timely enough manner to meet critical needs as well as even general needs, because this was not in a crisis, and it took us over 6 years to begin to finally start to deploy the system.
Go ahead, Toby.
Just to build on that quickly, and I think fundamental to it is, are we aligning the incentives for the outcomes that we ultimately want, right? Because all of us on this call have just been talking about the importance of investing in healthcare infrastructure, in technology infrastructure, and building out these fundamentals. But how do you pay for that? And Raj, you asked, what if there was a Gavi for global health technology that's trying to do those advanced market commitments that you are paying for what you want, which, take the case of vaccine, you're actually going to pay in advance for the COVID vaccine when it's released to reach every single person it's supposed to. And you can track that vaccine in real time, whether it's with Nextleaf or with Zipline, making sure it's getting there. You see it deployed and that registry created by the work that Josh is doing, use a biometric to prove a real person gets it. And then the person sitting in the Ministry of Health, looking at one of the dashboards that Ernest's team have built, can actually see a real person has gotten this vaccine, and we're going to pay for that performance. And that is going to fund the underlying health tech infrastructure. Because the current model often looks like, look, tons of bids out, put some sexy tech on there, it's bid candy, so as soon as the bid is won, let's cut out much of that as we can. I'm seeing a lot of nods here because we've probably been through this before. And we're not paying ultimately at the end of day for what we're trying to get. We haven't aligned those incentives well. And so I think there's a huge opportunity, not just the investment in the tech itself, but for paying the right things in the future could have a transformative impact.
Yeah, it's important to remember so much of what we just talked about is governments being able to do the procurement, knowing what they're getting, et cetera. But so much of the health tech spending is outside of government. It's coming from private foundations. It's coming from bilateral aid agencies. It's coming from international NGOs, coming with their own system, their own investment that maybe the government knows about it. Maybe there's coordination, but it's project funding. It's not systemic ongoing funding. That's still a very large piece of what's out there. Now, listen, we're kind of running short on time here, but I do want to get kind of a last take from everybody. I thought maybe one neat way to do it is just to hear how you think this whole thing is going to unfold, right? We did talk about months and years, maybe. There's so many threads you can pull on, but just kind of in general, how do you see this unfolding? Obviously, with your lens on as a social entrepreneur in the health tech space, how do you think this is going to go forward? Anybody want to pick that up as we wrap up our little conversation over coffee? In my case, tea.
Raj, I'll kick off. I love that prompt because it lets me bring out my hopeful side. I'm seeing a future where community health workers are truly supported and celebrated as the heroes they always have been, and that'll just be more obvious to everybody. I'm seeing a future where everyone is bought into the idea that everyone should get fast, personalized, high-quality healthcare. That we shift into a new phase of humanity with that question. I think tech is going to play a critical role in making that happen. I think we have to do it the right way. I'm also seeing those last two things connected, and they're a huge shift in talent in the world to focus on these types of challenges and problems. Every single large company is going to be figuring out how to work with everyone on this call. And a lot of people who work at those companies are going to be applying for open positions because meaningful work is going to be the only work worth doing. So I think that's where we're going.
I love it. Yeah, a lot of us figured that out a while ago. Anybody else want to start? Want to keep it from there?
Yeah, I'll jump in there. We're seeing that in addition to what Josh is saying, where people are rethinking work, what we're already seeing is that people are rethinking money. And so to Toby's point about aligning the incentives, what I think is really interesting is I'm seeing more funders talking with each other, and I'm seeing more funders wanting to come together to build something that is going to be integrated and is something that's going to work for countries. And that funding stream doesn't have to come just from the international aid community. You know, a friend of mine said this recently: when everybody's house is on fire, you've got to take care of your own house. And so increasingly what I hope that we see is that there's actually more local investment. There's a lot of really incredible private sector companies based in countries in Africa that are now starting to realize now that, oh wait, their workforce is impacted when something like COVID happens. And that if they don't invest in the health systems in their country, they're not going to have a workforce to keep their companies going. So I'm talking about, you know, companies that are rooted in countries in Africa and Asia. And so as we think differently in the future, I think ministries of health are going to realize that they have immense resources locally, financial resources, so that they can think differently about how to finance health systems. And it doesn't have to primarily or in part be based on checks coming internationally. And so, you know, whether the solution is sourced, you know, globally or not, that financial resources are there that can be tapped, and that the incentive to tap those local financial resources is the local workforce, is the local economy. And so I'm really interested to see how that part of the system does play out and what happens as a result.
Yeah, and it does connect to this idea that technology lets you get to the same outcome you want to get in a far more efficient way. That you might be able to see this huge return on investment where it isn't about dramatic scales of financing, it's about investing in the right things. That's a great message. Anybody else want to pick this up, how they see this going from here?
Yeah, I'll jump
Brittany?
in.
Yeah.
I agree with so much of what has been said on this call, and just building on Josh's point most recently, I think, you know, what I'm really hopeful about is that we begin to, you know, see that there can be the rejection of the concept that it's you know, just too difficult or inefficient to actually be providing high quality healthcare to people in remote places. You know, one of the things that we really believe very strongly at Zipline is that where you live shouldn't determine whether you live. And I think you see, you know, this recognition now around like, how do you actually balance efficiency and access? And, you know, a lot of the tools that are represented here, I think can show the way to how that's possible. And that's kind of going back to one of Josh's earlier points about like, rejecting the false choice. And so I think that you can have, access at scale that reaches all people in an equitable way, and also have the efficiency in a health system and quality that is what everyone is looking for. So I'm really hopeful that that we're able to actually design that future together coming out of this, and I really look forward to that stage of this recovery.
Yeah, I love that hopeful message. I really do think there's so much. It's not like we're starting from zero. There's so much that has been built in this community over the last decade or more that we can build on. Toby or Ernest, anybody want to jump in now?
I can go. I think staying optimistic. I think what COVID is for the African continent in particular making us realize is that prevention is non-negotiable right now, right? We simply do not have the resources to put up the same fights that America and Europe are fighting with the ventilators they have and all of that. If it goes down that path, we are done for. And I think it's being acknowledged now that, look, if we let this thing spread, we're not containing this, right? And so we have, I think for the first time, continent-wide hyper focus on how are we actually going to mitigate this? How are we going to flatten the curve? And everyone is fully engaged. Second, the African leaders who typically don't get engaged in health, or health is a bit of a stepchild ministry in their countries, are stuck in their countries. They have to use the crappy health systems that they have helped to create. And so they, are forced to remain engaged. And I'm hoping this is also a moment where there'll be a change of heart and a change of commitment from leadership to actually fix their health systems. And then thirdly, I think is almost like whether, sadly, it took COVID to force a certain solidarity that crosses, wealth and class boundaries, right? Now you realize that you better care about that guy living in the slum or that child living in the slum, because if they get infected again, you're going to have wave 2, wave 3, wave 4, wave 5, wave 6 of this epidemic, and Ernest will never be able to leave his house, right? So we're all locked in together, and in essence, we're as good as our weakest link, and we have to make sure that we shore up the weakest links. And I think everybody's beginning to get that now. Obviously, there's a huge fake news thing coming along that I hope, again, there's significant effort to debunk that, because that could, detract from a lot of the gains. But I do remain optimistic that this is really our moment, our crucible moment, as a continent from which hopefully we'll emerge better, stronger, more resilient.
That's a great message, Ernest. I actually had South Africa's Minister of Health at the time, a couple of years ago, on stage. I was interviewing him, and he actually made the point that, we need to get to the stage where ministers like me and presidents of our countries can get all of our healthcare in our own country. And yeah, you're absolutely right to your second point. This is gonna be a real forcing mechanism, because people will have to get their healthcare where they live, no matter their resources. Yeah, Toby, you want to jump in with the last thought?
Just quickly, I would say balanced optimism. I think some countries and some partners are absolutely going to step up. I think very pragmatically some won't, and we are going to pay a high cost in lives for failures that we've made to invest in health infrastructure and pandemic preparation that we should have made years ago. What I am optimistic about, and I think technology is only a piece, but the role technology really can play, is increasing the transparency of what's happening in real time, because I do fundamentally believe there's an entire generation of optimistic, passionate, driven people who really care about these issues. And if we can respond faster and learn faster and see what's happening in real time, that I think could be the sea change that drives this response going forward.
A great message. Yeah, I remember looking into this a while ago and looking at the low-income countries in the world and how much do they spend per person per year on healthcare, and then comparing that to all the debates that happen in the United States over healthcare, where I live, and across Europe on investments in healthcare, and the gap is so dramatic. It's something from $50 a year to $200 a year per person in low-income countries. And in wealthy countries, it can be several $1,000s or more per person per year. And that gap, where there is no way we're going to overcome that gap in the short term with money alone. But I think to Brittany's point, we can still say every life is equal and that we can't allow people to die of basic causes. And the way we get there is through new health technologies. It's through the organizations all of you are building to try to address need where it exists in a really efficient new way, to do it, not just to replicate systems in other countries, but to build new systems that are stronger and that are relevant and locally owned to the context where people work. So I really appreciate all the work you're all doing. Thank you for that. And thank you for taking some time just to chat with me today about this and to see each other. Hopefully it gives you some inspiration as it gives to me and maybe to the folks who are watching this, that there is a way forward. And I really do hope we can use this as a chance to underline the importance of remembering what we've already built and thinking about this, yes, as a real crisis, something we need to respond to, but not as a vertical program, not as a one-off, not as a project, but as a real moment for humanity. So thank you all for taking a little bit of time. It's been great to see you, and let's do it again.
Thanks, Raj, and thanks to Devex.
Thanks, Raj. Great to see you all.
Nice to see all of you.
Bye, everyone.
Bye.